This video applies to all staff that are involved with medicines on a day-to-day basis on the wards. The video sets out the practical aspects of how medicines should be handled on the ward, on transfer and on discharge. The video aims to ensure there is a consistent approach to medicines management across all wards to minimise the risk of missed doses and to reduce waste. Admitting patients. When patients are admitted, they may bring in their patient's own drugs, or PODs. PODs should be utilised to dose patients during their admission once they have been assessed as suitable to use. The suitability can be assessed by either a pharmacist, or a nurse, or a technician. PODs are patients' property and therefore verbal consent must be given before they are used. Where a POD has been stopped on admission, permission should be given by the patient before disposing of the medicine. If the patient refuses to give permission, the drug should be placed in a bag in the locker and a sticker added to it to say, "Do not use." PODs must be stored in the patient bedside locker where available. Please check the packaging is intact and the expiry date has not passed. The label is clearly readable and contains the following information: name and strength of medication, dose and frequency, patient's name, date dispensed must be within the last 6 months, and the name and address of dispensing chemist or doctor. Drug rounds. As previously mentioned, patients' own drugs can be used on drug rounds with their permission. These will be stored in the patient's locker beside their bed. Also used will be a drugs trolley containing ward stock. At the end of a drugs round, the trolley should be locked and tethered when finished. When administrating medications within the trust, the following points need to be considered. It is important to get positive patient ID before administering any drug. As well as controlled drugs, within the trust we also double check and witness IVs, or intravenous drugs. Missed doses. Doses of medication should not be missed, especially critical medicines. Here is a list of critical medicines. However, if doses are unavoidably missed, then after 2 missed doses of critical medicines, a Datex needs to be completed. With non-critical medicines, a Datex is required after 4 missed doses. If the patient is deemed able to self-administer their own drugs, there is a separate policy on this, and please refer to the documents library. When entering the treatment room, it is important that this is also locked, and when exiting the treatment room, to make sure it is locked again. Fridges, where drugs are stored, are also required to be locked. Their temperature also needs to be monitored, either on the ward, on the forms you have to accompany the fridge, or remotely. Stock drugs. Each ward has designated stock drugs. These drugs are stored in the ward treatment room, cupboards, and drugs trolley. Each ward is provided with a ward stock list that nurses should refer to if they are unsure of what is stocked on the ward. Each ward receives a minimum of a weekly ward stock top-up service from pharmacy. To order ward stock outside of the top-up service, order in the A4 ward stock book. The stock list should be reviewed on a periodic basis with the ward sister and ward pharmacist to ensure the list remained appropriate for the clinical area. Non-stocks. Non-stocks are those drugs that are not stocked by the ward. Non-stocks are supplied on a named patient basis and would generally be labelled with directions to allow them to be used on discharge. Non-stock drugs must be stored in the patient's bedside locker when available with the patient's PODs. These drugs must be ordered using the electronic non-stock ordering process on the electronic prescribing system. If the non-stock drug is urgent, please indicate this on the electronic order note. When transferring patients internally, or including West Cornwall Hospital and St Michael's Hospital, it is important that patients' own drugs and non-stocks are transferred with them. Please remember to check the CD cupboard, the fridge, and the patient's locker, which contains their patient's own drugs, and send them with the patient. Please also use the green bags provided when transferring drugs. By transferring the drugs with the patient, this helps reduce error on the receiving area and also future missed doses. Medical gases. Medical gases should be stored and secured in the approved storage area in your ward or department. For replacement cylinders, ring Mighty Help Desk on 2468. If you have too many bottles, then also ring 2468 to have them picked up. Failure to do this could lead to falls, injury, damage to the equipment, supply shortages or fire. always use a transportation bracket when transferring patients. Not using a transportation bracket can lead to injury or fire. There have been incidents nationally where fires and fatal injuries have occurred due to poor practice. If you need a medical gas that is not usually stored in your area, please contact pharmacy to order. Obtaining medicines out of hours. The emergency medicines cupboard is located at the top of the ramp leading to pharmacy at RCH and in the urgent care centre at West Cornwall. St Michael's Hospital does not have one, so if the medication is not available in another area, the on-call pharmacist will need to be contacted. To find out if the drugs are located in the emergency medicines cupboard, you can do the following. Open JAC, select Stop Maintenance, select K-Ward. Enter the drug you are looking for. Select the location you are in and a list of areas which hold the drug is displayed. If the drug is available in the emergency medicines cupboard, please take from here first, as this reduces the interruptions for other wards and departments and the depletion of their stock. If it is not available in the emergency medicines cupboard, medicines can be borrowed from other areas but only when absolutely necessary. Controlled drugs can never be borrowed. In an emergency, a patient can be administered a single dose of controlled drug directly from any ward stock. For more information on this, please refer to the Controlled Drug Standard Operating Procedure. Discharge. Bleep the ward pharmacist to process the TTO and to speak to the patient. If they are unavailable or it is out of hours, please remember to send pods and non-stocks to pharmacy with the TTO printout. By remembering to transfer pods and non-stocks with the patient or sending them to pharmacy on discharge, this helps to reduce waste or error for the patient when they're either transferred or discharged. Once the TTO order arrives in pharmacy, you can track it using the online system. A minimum of 14 days worth must be supplied on discharge, with the exception of medicines required for a specific course length. When a patient's sufficient supply of medicines at home, and there has been no change to the dose during the admission, no further supply will be given on discharge. The eTTO printout sent up with the patient's drugs will state the patient's own. When the patient is ready to leave, print the e-discharge form. This should then be used to check that the correct medications have been dispensed for the patient, as it has the most up-to-date list of the medications ordered. This is an important final safety check. The nurse should go through the medication with the patient. They should explain what the medications are for, how to take them, and any basic counselling. The nurse should also use medication safety reminder form, which has come from pharmacy in the bag with the TTO medication, to advise the patient about common side effects. If further information is required, refer to the ward pharmacist as appropriate. The patient should then be provided with a copy of the e-discharge and informed that an electronic copy has been sent to their GP. This is automatically done with the completion of the e-discharge. This is a vital step in ensuring good communication between primary and secondary care. Remember, this should only be done at the point of discharge.
Hello, my name is Ian Davidson. I'm the Chief Pharmacist at the Royal Cornwall Hospital. Most of our patients take medicines during their admission, and it's therefore absolutely vital that you know the correct processes for the safe management of medicines during their stay. Safe medicines management is absolutely crucial for patient safety and in reducing harm to our patients through missed doses and through drug errors. Thank you very much for watching this video, and if you have any other further questions, please speak to your ward pharmacy team.